Hello. Hey, y'all. Welcome back to another episode of RX Info on the Go. I am Dr. Ravin, PharmD. And if you have not been or seen one of my episodes, this is a segment where I talk about all things pharmacy and giving you information that you never knew you needed. So, um, we're going to get started, but First, first, if you would do me a favor, like, tag, and share. I would appreciate it if you could like, tag, and share so we can get this information out to you. It could be beneficial for someone. You never know who's going to hear it. So I just want to make sure that everyone has the opportunity to get this information. Um, like I said, you never know who's going to need it. Um, so we are going to talk today about Claritin or Loratadine. That's the chemical name is Loratadine. The marketed name is Claritin. And we are going to continue that talk because we're in the season of cough and cold right now, right? So we want to make sure that we are getting people the information that they need about the different products that they can possibly use on a daily basis to help with those cough and cold symptoms, as well as for people who just have ongoing allergies. In Texas, allergies are big. So I know for me, especially when I moved from Louisiana to Texas, I definitely felt the difference. And even moving from one city in Texas to another city or like another region, you can definitely tell the difference in whether your allergies will flare up or not. So this is one of those medications that you will actually get to use, or actually most people kind of have used over time. So we are going to get started. We're talking about Claritin today, or Loratadine. Now, Claritin or Loratadine is what we would call a second generation antihistamine. It is one of those antihistamines that work pretty much over 24 hours. You do need to take it just once a day instead of taking it multiple times a day, um, like you would, say, a Benadryl. It is considered a second generation antihistamine because it works on the histamine receptors, the specific histamine receptors that are outside of the central nervous system, causing you to have less side effects than what you would have with a Benadryl, for instance. So, um, if like with Benadryl, you would end up having like the drowsiness and things like that. Claritin, typically, you do not have that type of a side effect with Claritin. That's not to say that you won't have it, but it is a possibility, and it is a possibility that you could still have the drowsiness with that particular medication just because of the nature of the medicine. But for the most part, most people do not get drowsy with Claritin. Now, it can be used pretty much for the same things as Benadryl, besides the drowsiness factor, or for the sleep aid factor. It is typically used for not an allergic reaction, but allergies. And actually, I take that back. So it can be used for allergies on a daily basis. You would take one tablet once a day, which would be 10 milligrams for adults. For ages 2 to 5, they would do 5 milligrams, and at ages 6 and over, they would do 10 milligrams. So you can take it on a daily basis for allergies. Also, it can be used for an allergic reaction, but not your typical allergic reaction. This is not something that you would take if you are having an allergic reaction and kind of need that emergency relief like a Benadryl would. Instead, this is something if you are having, say, like a reaction to something that's making you itch, or giving you hives, but not actually, closing your throat or anything like that. We've seen physicians give people Claritin along with some other antihistamines that are not the H1 antihistamines, or not the H1 receptors antihistamines. But we'll talk about what those other ones are. But we've seen them group all of the antihistamines together when someone's having like a severe allergic reaction to, say, poison ivy, and they're just like really itching and can't get rid of the hives. The doctors will try to load them up with antihistamines from every angle. So that will be including like a Benadryl, not the Benadryl, but it would be including a Claritin along with like a Pepsid, and sometimes along with the Benadryl. So, they would attack it from all angles. I have seen that. It's not something that I see a lot of, but I have seen it in the past. So to say that Claritin can be used for that type of non-allergic reaction, or and that would be the better explanation. Now, it can be used for just your typical cough and cold, runny nose, watery eyes, that type of thing that you would have with cold symptoms or allergy symptoms. You would still take it once a day. It can be taken on a once a day as needed, and it still, will work. Although I do believe that in my experience, I've seen it work better when you're taking it for a long period of time. So if you are taking it for like 7 days, it does have a better effect than if you're just taking it as needed. Like I said, it does work for 24 hours, so you're only taking it once a day. And for most people, it's working, at 24 hours. Some people will say that it doesn't last that long for them, but we have to remember that every person is different. Everybody metabolizes things differently. So that person who it may not work for the full 24 hours, it's possible that they are metabolizing it a lot quicker than what someone else is. That's a whole nother topic, and we'll get to that one day. But that's that part. As far as adverse effects are concerned, now I did mention that some people can get drowsy from this. um it's not unheard of. I actually have, you know close people I know have said, hey, I still get sleepy with this one. It's not really supposed to, but it still happens, like I said, just because of the nature of the medication. And on top of that, it can also cause headaches. um that's not something that we hear a lot of, but it is something that it can happen. And of course, because it is an antihistamine, it can dry out all of, um, pretty much all of the canals. So you can have dry mouth, dry throat, dry eyes, dry nose. That's some of the side effects that you can get from Claritin. Otherwise, it is really well tolerated. There are no drug interactions that I have seen documented as far as that particular one interacting with any other medications that you're taking. So it's typically a safe one to take if you are on other medications. Um, there's just a couple of other things about this one. So if you are a kidney disease patient or a liver disease patient, you definitely need to talk to your doctor before taking this one. It Because of the way that this medication is metabolized and excreted from the system, the way that it's broken down and excreted from the system, you would definitely need to talk to your doctor about a dose adjustment or possibly not taking it at all. That is something to be aware of. And then also for your children, we just need to make sure that if they are under the age of 2, you are talking to the doctor before giving it to them. Now, the ages 2 to 5, it is definitely cleared for, and there are dosing instructions on the actual packages. However, ages 2 to 5 would typically get 5 milligrams, once a day. It's not really dose based on weight. Like some of the other ones, it is dose based on age. So under the age of 2, consult a physician or pharmacist. Ages 2 to 5, 5 milligrams. Ages 6 and over, 10 milligrams. Now, this is available as a tablet, or oral dissolvable tablet as well, which is the tablets that you just kind of put on a tongue and you allow it to dissolve with your saliva, kind of like sucking on it, and swallowing as you're sucking on it. Um, then there's the liquid, of course. So you have the liquid for children or adults who can't swallow. Oral dissolvable tablets. You have a liquid gel that's now available, which is kind of like the little liquid in the capsule so that it gets into the system quicker. Um, and which chewable, yes, also you have a chewable also. So it comes in variety of different forms just so that it's easier to get into your system. There are other Claritin products that are marketed with other ingredients. So typically, like Benadryl is included in several different things, like your NyQuils and, you know, Theraflus, things like that. Claritin is not like that. Claritin does have one other product though that it is combined with, and that's pseudoephedrine, and that will make it a Claritin D, is what it is marketed as, and it has the decongestant portion of it, which is the pseudoephedrine, along with the Claritin, which is the antihistamine portion. So that kind of helps to balance out and keep you from getting so dry, especially if you are having problems with runny nose, and stuffiness. So you kind of get to balance out that runny nose and stuffiness with the Claritin D product. Um, I think I have probably said everything that there is to know about Claritin. It used to be prescription. They found that it worked really well and was really tolerated well, so that they were able to put it over the counter. It does work really well for a lot of people. If you find that it doesn't work for you, that's okay. There are other antihistamines that are available. We call them Me Too drugs because they work the same way, but you have to realize that not every medication will work for every person. So just keep that in mind. Um, and then also keep in mind that every person's body is different. So, as I mentioned earlier, somebody might metabolize something and break it down quicker so that it does not last in their system as long. And then others, they're not metabolizing it the way that it should. So, it might last in their system longer than, than what the typical person would. Everybody's body is different, so we can't always expect for one thing to work for one person and do the same thing for the next person. Now, would we like it to that, would that science be perfect for it to do so? Yes, but it's not always that case. So that is our talk on Claritin or Loratadine. I know that was really quick, but the information just kind of flows a little bit, just like the Benadryl one does. It's antihistamines, and this is one that I see on a daily basis. I recommend it to people on a daily basis. People are asking, what type of antihistamine can I take? Typically, Claritin is my first choice, unless there's something else that's going on. And then I would typically, direct them to the next product based on what their situations may be. But if someone's saying, hey, I have runny nose, watery eyes, I need to take an antihistamine on a daily basis, what do you recommend? Claritin is going to be my first choice. And that's just coming from me. Um, Again, it does not work for everybody, but it does work for a lot of people, hence it's still on the market. Now, that's that information about Claritin. If you have any questions or concerns, if you can always inbox me. You can always send me a DM. You can always go to my website, which is www.drravenformd.com, and you can send me a message there as well. I do review my messages. I try to get back with everyone as they are messaging me. I do work full time as a pharmacist, so just keep that in mind. If I don't get back with you right away, it's not that I'm trying to avoid you. I am working a full time pharmacist as well as a full time mom. And, hey, life will life, but I definitely respond to those who reach out to me. If you have any questions, please don't hesitate. That's why I'm here. I love doing this and I love talking to everyone. So just please go ahead and send that message if you have a question, or you can just drop it in the comments. I hope everybody's having a beautiful Wednesday. I hope that you are enjoying your day. And, hey, if you need anything else, I'm here to answer your questions. Last but not least, I said it before, but I'll say it again. Please like, tag, and share. I would appreciate all the support that you could give. And sometimes support is not necessarily buying something, but just sharing it with someone who knows, who needs to know some of this information. In addition to that, If you do want to purchase a book or a notebook or a cup or mug or a t-shirt or a hoodie, because it is hoodie season approaching, and you love Jesus Christ, you can go ahead and go over to my website. um, I have a bunch of things over there, especially for believers. If you're not a believer, I invite you to get to know him. And that's going to be my spew for today. I hope y'all have a really amazing day. I love y'all, and I will see y'all next week with another antihistamine. Alrighty.